Well, so many Americans are feeling the pressure these days between COVID, working from home, inflation, and even the Russia-Ukraine war. Many are feeling so anxious.
All this week in our Health Check 22 series, we're looking at some of this year's biggest impacts on our health. Tonight, we look at the state of our mental well-being.
It was really bad. I didn't know how to calm myself down.
Last year, Brianna Arteaga noticed her anxiety was starting to get the best of her. The 15-year-old says she knew she needed help after breaking down at school one day.
I couldn't breathe and I just kind of felt overwhelmed. So I just couldn't. So I went to the bathroom and I started crying. I was like, well, why am I feeling like this?
Brianna turned to her mom for help and started attending an online group therapy session.
They talked about mindfulness and ways to deal with school and school stress and home stress and friends and stuff.
The pandemic kind of had this chain reaction of things that were happening to people that would never normally think that they would ever experience that level of stress.
Patrick Rogers is clinical director of behavioral health at Nevada Health Centers. He says the pandemic had a major impact on every demographic, but especially teenagers.
I think the biggest effect was really on our high schoolers, on the adolescents, again, because of that social piece, right? Kids want to fit into a group, and all of a sudden there was no group to even be a part of.
As a result, Rogers says Nevada's experiencing an increase in teen drug and alcohol use and thoughts of suicide. The biggest issue is reaching the teens as well as adults who need help.
Access has always been an issue for the Nevadans to get in to see a behavioral health provider, get in and see one on time and consistently.
You know, historically, Nevada, among the states, has been one of the lowest in its budget for mental health. Is that still a challenge here?
Absolutely. It is absolutely. Nevada's ranked dead last. We're 51st in the nation since 2011.
Rogers says he feels the state's hands are tied as many programs are experiencing budget cuts, including behavioral health. But he says it's not just a lack of funding.
It's a workforce issue as well.
To address that issue, in the long term, Rogers says recruiting programs are actively educating middle school, high school, and college students about careers in the healthcare field.
And again, with the pandemic, if you think about it, there's more people that are actually seeking help.
Crisis Support Services of Nevada is one place where many are turning for support. Executive Director Rochelle Pellizier says their 24-hour hotline is experiencing an increase in escalated calls.
When someone calls in, they are much closer to that imminent risk to themselves or someone else, and we're having to deploy emergency services much more frequently.
Just like Rogers, Pellizier says it's the youngest demographic that seems to have been hit the hardest.
Our kids are struggling, and we see it especially now.
To reach those kids, Crisis Support Service staff and volunteers are willing to speak with and even text with anyone needing their help.
They'll go into the bathroom at school and text us because they're depressed, they're anxious, they're having a panic attack. What we've found, when we give kids our phone numbers, they use it.
And that's the good news. More kids and adults are willing to seek assistance these days. Rogers says that's one of the highlights to come out of all this.
The pandemic, for all the issues that it really caused, really opened our eyes as the general public to an acceptance of what mental health really is.
Brianna Arteaga agrees and has a message for anyone considering reaching out.
It's okay to not be okay, right? Let someone know. Just talk to someone. It really helps just to talk about it. If you keep it in, it's not going to make anything any better.
So if you or someone you know needs to talk, call Crisis Support Services of Nevada. The number's 800-273-8255 or text the word CARE to 839-863. Their lines are open 24 hours a day, every day, offering free and confidential support. The story is part of our 13 Connects initiative sponsored by Subaru of Las Vegas, America First Credit Union, and Landmark Recovery.